afternoon, everyone. I'm Dr. Vaibhav Ingole. I'm a consultant physician and I've been practicing medicine for last 3 years. And today we are going to talk about hypertension in brief and what is hypertension and how to prevent it and how to treat the cases of hypertension in brief. Okay. So what is hypertension? So hypertension is nothing but the pressure exerted by the blood vessels on the bloodstream. So whenever your heart pumps the blood from the heart, and as it travels through the vessels, there is the pressure exerted by this is the blood vessel, and there is blood traveling through that. So the pressure exerted by the walls on the bloodstream is nothing but your blood pressure. So normally, every person, every individual will like to have a normal blood pressure. But in normal person, this pressure rises and falls throughout the day. There is fluctuation in blood pressures, but when it is persistently high, like throughout the day it is high and on regular basis it is continuously above the normal range, we call it as hypertension. So what is the normal range for blood pressure? Normal range for blood pressure falls between 100 to 140 for systolic and 60 to 90 for diastolic. So what are systolic and diastolic blood pressures? So systolic blood pressure is nothing but in simple terms, whenever your heart is pumping the blood, as the blood flows through the vessels, the pressure during that time is called as systolic. And when the heart is in relaxed state and is not pumping the blood, at that time the pressure inside the blood vessel is called as diastolic pressure. So the range is like 100 to 140 for systolic and 60 to 90 for diastolic. So if your blood pressure is anywhere between this range, it is considered as normal. When it is persistently high on 3 or 4 consecutive readings, your blood pressure is beyond 140. At that time, we can call it as having hypertension. So normally what happens is patients having this high blood pressure generally are not aware of having this issue, and most of the time it is undiagnosed, but it can lead to serious complications in the long term. Now, in like if a patient is having recently new onset hypertension, he will not notice it. There will be no signs and symptoms of the disease, but it will be there. But over the period of time, he will be susceptible for developing serious complications like stroke or what we call it as paralysis in layman's term. He's also susceptible for developing heart disease. He's also susceptible for developing your chronic kidney diseases, and also responsible for damage to the eye. So all these complications are there because of the hypertension. It occurs over time, like over a period of years. It does not happen in a single day. And why you are having, if you say that if you go to a clinician or anywhere, and if you measure your blood pressure and if it is in the higher range, so you might wonder why my blood pressure is on the higher side. So it is because of the unhealthy lifestyle and sedentary lifestyle, not doing enough exercise. If you are a smoker, or if you are having a high intake of tobacco or alcohol consumption, all these factors, sedentary lifestyle, they will lead to increase in blood pressure over time. So what are the other factors that can lead to hypertension or high blood pressure? So these include your age. As you age, your vessels become stiff. The elasticity of the blood vessels decreases as you age, which is a normal phenomenon. But that is bound to happen. As another thing is, males are more prone for hypertension compared to females. Second thing is your weight, body weight. As the weight increases, you are more prone for developing the hypertension. Why? Because there will be like more pressure on the heart to pump the blood against the resistance that is inside the vessel because of the thickening of the vessels. Another thing is excess intake of salt in the diet. That can also lead to blood pressure. And one more thing that I would like to mention is you might have seen that all the patients have someone in their family who's having hypertension. So there is also strong family history going around here. So if you are if your relative, if your father, your grandfather, anyone is having hypertension, then there is a possibility that you may end up having hypertension later on because of the there is some genetic predisposition for development of hypertension. Another thing is if you are having heavy intake of processed foods, fatty foods, because now we are living in a very fast life, so we don't have that much time to look after our food. We have haphazard habits like eating at any time, eating outside. So all these factors contribute to development of the hypertension. Another thing is because of this fast life, now we are under a lot of stress. So because of this stress, and it is nowadays not able to manage the stress properly because of the excessive workload at your work, and not getting enough sleep. So all these factors can cause hypertension. Now, since as I mentioned that it does not have any signs and symptoms in the initial stages, and that's why it is called a silent killer, because the majority of the patients that I see in clinical practice, they are not aware of the hypertension, and they are mostly asymptomatic. They don't have any signs and symptoms and are diagnosed because they are presenting to me with some other illness. And at that time, when I measure the blood pressure, it comes to be on the higher side. But these patients are at more risk of developing heart disease or kidney disease later on in life. That's why early diagnosis of the hypertension in the initial stage is very important in order to prevent such complications. So normally when the patient is having high blood pressure, some may experience some minor symptoms like having early morning headaches, having lightheadedness, nausea, vomiting, or some blood vision kind of symptoms can occur in some patients, but most of the patients are asymptomatic. If these symptoms are there, if you are having these kind of symptoms, then you should get your blood pressure checked immediately to rule out whether you are having hypertension or not. So what to do to diagnose the hypertension? It's very simple. Just go to any physician or clinician who is nearby you and get your blood pressure checked, and get it checked on three subsequent days. Not if one reading is high, we cannot completely say that you are having hypertension. Maybe it is a transient rise in blood pressure because of some other cause. So what you have to do as a patient, you have to go to the your nearest physician and get it checked on 3 consecutive days. And if all the readings are on the higher side, then you can then the physician can start you on some medicine. Normally the blood pressure, healthy blood pressure is around 120 by 80 mm of Hg. Any blood pressure above 140 on the systolic side and 90 on the diastolic side, if your blood pressure is above 140 by 90, then you can consider that you are having hypertension, and then you can follow the advice of your physician. So what steps you can take on your personal level? There are certain things in addition to the medicines that are being prescribed to you, what you can do on your personal level to lower your blood pressure. So there are a few steps that you can do, such as regular exercise, proper adequate diet, meditation, and management of stress, like taking adequate sleep, regular exercise, healthy diet, avoidance of smoking and alcohol, avoidance of tobacco chewing, and taking those medicines that are prescribed to you on regular basis without skipping those medicines in between. So if the blood pressure is successfully controlled with lifestyle modification, what lifestyle modifications do? They will help to prolong the inevitable. For example, if you are having blood pressure of 140 by 90 or 150, and you are of the opinion like you want to if you don't want to start the medicine at that stage, so what you can do is you can do these lifestyle modifications and start initially on medicine, and then with lifestyle modification, if your blood pressure is within normal range, then you can keep that medicines on hold. And what it will do, prolong that medicine, because now you will not blood pressure will be controlled by your lifestyle modification, and you will not need those medicines at this stage, but later on they will you will eventually need them. But basically right now, if you are having these lifestyle modifications, you will be able to have normal blood pressure without medicines. So what we will talk about these lifestyle modifications in brief. So what about exercise? What you can do? So you can go for brisk walking or jogging, or you can do cycling, swimming, or even cardio, whatever exercise is okay with you, that is fine. So apart from that, what that you should consume? So you should consume foods that are rich in potassium, foods that are like coconut water, or all the vegetables and fruits should be in abundant amount. And you should consume foods that are less in sodium, like salty foods, like your pickles, papad. All these foods need to be avoided. And second thing, avoiding or reducing the amount of processed foods in your diet should also help. Another thing that you can do is visiting your consultant or physician regularly and get your blood pressure monitored by him. Or there is another thing that you can do is having an ambulatory blood pressure apparatus, and that measures your blood pressure throughout the day. And with that, you will get reading throughout the day how your blood pressure stays, and that will also help your physician to adjust the dose of the medicine and to understand your blood pressure in a better way. And for smokers, I would like to say, try to stop smoking as soon as possible, because it's not going to help you in any way. Because the more you smoke, the more it's going to cause problems, not just hypertension, it will also cause occlusion of blood vessels, and will lead to strokes and heart attacks, like conditions later on in the future. Another thing that you can do is doing some yoga or meditation and getting proper sleep, like 7 to 8 hours of sleep on daily basis is advised. And then the last and most important thing that most patients fail to do. Now, as a clinician, what I have experienced in my clinical practice is most of the patients initially start medicine and they take that medicine continuously, max to max, for 1 to 2 months. And after that, they feel good that we are having normal blood pressure, and they stop that medicine on their own. And then they adjust that dose accordingly. Like like we will take every once in 2 to 3 days or once in a week. They adjust according to their own like they make their own decisions. And what happens after that, they come again and they say that our blood pressure is raised, we are having chest pain, we are having sweating. And then when we take the ECG, it comes out that the patient is having myocardial infarction or heart attack. So this could have been prevented if they were taking their medicines on regular basis. So that is the most important thing while treating your hypertension, that you need to take those medicines properly on regular basis. If you are not taking those medicines and then you are having to face the complications, then you are the only sole person responsible for that, not your doctor. So whenever you are prescribed some medicine, try to take that medicine regularly. Don't change that medicine on your own. Don't stop those medicines, and get your blood pressure monitored regularly. And if the doctor feels that he needs to change that medicine, he will do it on his own accord. Okay, that's the only thing that I would like to tell you. Thank you.